Hi everyone, my name's Karen and I work at the Eve Appeal, the UK's gynecological cancer research charity. So it's Ovarian Cancer Awareness Month and I am making a series of videos with the lovely Dr. Ellie Cannon.
Hello.
GP and wonderful ambassador of the Eve Appeal. So in this section we're going to be talking about the causes and risks of ovarian cancer. Ellie, so people have been messaging in with questions.
Yep.
First question. Is it true that going through IVF can increase your risk of ovarian cancer?
Okay, very good question. So I would say that no, at the moment we do not think that going through IVF increases your risk of ovarian cancer. I think that's really important to say that. However,
There's always a however.
There are obviously, if you're going through IVF, you are definitely going through hormonal treatments. And also you may have a background of hormonal problems that mean you need IVF in the first place. Also, women going through IVF tend to be obviously under much greater surveillance than other women. They're having scans all the time. People are keeping a very close eye. So there has been some sort of correlation, so a little bit of sort of people noticing that women who've had IVF seem to have maybe more cases of ovarian cancer, but there's certainly nothing to suggest one is causing the other.
Someone has said, I'm a South Asian woman. Does my ethnicity increase my risk of ovarian cancer?
So there are some sort of ethnic differences with ovarian cancer, and we do see it more commonly in certain populations, and actually it's more common in Caucasian women. So I would say no, being a South Asian woman is not a risk factor for ovarian cancer.
Does going through the menopause or being post-menopausal increase my risk of ovarian cancer? Someone has asked.
So we know, like with a lot of cancers, that ovarian cancer is more common as you get older. So we diagnose it more in women over 50 than under 50. So it's not going through the menopause per se, it's actually the age which increases your risk of ovarian cancer. Then there are obviously other sorts of factors, for example, HRT.
Hormone replacement therapy.
Replacement therapy that might be relevant to a woman who's postmenopausal, which can very slightly increase your risk of ovarian cancer. So there are some factors, but it's not going through the menopause per se that increases your risk.
Okay. So someone has asked, I have fibroids and endometriosis. Does this increase my risk of ovarian cancer?
So fibroids and endometriosis do not increase your risk of ovarian cancer. They are not considered to be risk factors. Generally, a woman who has fibroids or endometriosis, or both together, is going to be under closer surveillance than another woman. So it may be that it is more commonly diagnosed for that reason, because we're keeping a closer eye, there's more ultrasounds and more blood tests going on. But there certainly are not studies that definitively say that those conditions cause ovarian cancer.
Does ovarian cancer, Ellie, only affect older women?
No, it doesn't. Ovarian cancer is certainly more common in women over the age of 50, but there are 1,000 women who are diagnosed every year in the UK with ovarian cancer who are under 50. Now, it's quite likely that of those women, a large proportion will have a genetic tendency, so they will have what we call a BRCA gene mutation.
So there's kind of a reason that they've been diagnosed at a younger age.
There is a reason, but we will certainly see cases of women who are under 50 who will be diagnosed with ovarian cancer, but it is not common. Ovarian cancer is not a common cancer to start with.
How many are diagnosed every year in the UK?
So it's around 7,400 women in the UK will be diagnosed with ovarian cancer each year. And we know that 1,000 of those will be under 50.
That's a lot, isn't it?
It's
to be
a lot,
diagnosed under 50,
It is a lot. As I say, they will more than likely mostly be the women with what we call a BRCA mutation. So it is something that we think more about in older women, But that is not to say it doesn't happen in younger women.
This is an interesting question that someone has written in with. I've heard that your ovaries can shrink due to stress and cause period problems. Is that true? I've never heard of that.
So I've never heard that either, but I think I know where that comes from.
Yeah.
Our cycles and our periods are definitely affected by a lot of different things. So we all know that it will be affected if we travel, and stress is one of those things where anecdotally, certainly in clinic, women will come in and will have been going through a stressful time, but that is not anything to do with ovary shrinking. That's just something that we notice an effect on the cycle, probably from stress hormones.
I think this is a myth, but you're going to tell me. Can using talcum powder on your vulva cause ovarian cancer?
Well, this is obviously...
I've heard that a lot.
Well,
yeah.
Obviously this is a very interesting question now, because there have been actually court cases, haven't there, in the States to do with the association of ovarian cancer and the use of talcum powder. As far as I'm aware, the jury is still out on that, whether or not there is a very strong, what we call causative link, i.e. the talcum powder was the risk factor, was the cause of the ovarian cancer. But that has sort of run away with us, because there have been these cases and sort of payouts in America to do with talcum powder. So it is not backed up by science that there is a link between the two.
And we shouldn't, I guess, really need to put talcum powder all over our vulva anyway, so just don't use it.
Well, I think that's exactly right. I mean, you know, sort of why fix what isn't broken? Yeah. I mean, you don't, as you say, you don't need to use talcum powder on your vulva. It isn't sort of part of good gynae hygiene. So there isn't actually a need to do it. So
if in doubt, do without. Yeah,
exactly.
Great. So I'm going to ask you about the contraceptive pill. So we get lots of questions about this at the Eva pill. Does taking the pill increase your risk of ovarian cancer?
No, actually, the contraceptive pill has been shown to decrease
the opposite,
your risk of ovarian cancer. Yes. So with the contraceptive pill, and by that we're talking about the combined pill, so what people would really think of as the normal pill with two hormones in, estrogen and progesterone. There are risks with taking the pill, and there are also benefits, obviously, and all of those have to be weighed up, because if we're going to talk about the risks of the contraceptive pill, we're not just looking at ovarian cancer, we're also looking at other cancers and other health problems. Specifically in terms of ovarian cancer,
because this is specifically an ovarian cancer video.
Exactly. Then we know that using the combined oral contraceptive pill for 5 years or more appears to be protective, so those women are less likely to develop ovarian cancer. Now that obviously is not a reason to take it.
No.
Women take the pill for other reasons.
But going on the pill doesn't increase your risk.
It does not increase your risk of ovarian cancer, no.